Epilepsy remains one of the major neurological problems that affects our community and society as a whole. And in India especially, we in India have the maximum number of epilepsy patients in the whole world. 20% of people with epilepsy are from our country. That means every 5 of patients with epilepsy are Indians. And therefore, it is a much more significant day for us than in other countries, and a lot of myths and superstitions that concern epilepsy and its treatment. So what I would like to highlight here is that epilepsy is a common disease, treatment is easily available, and treatment is very effective. But the most important thing is to ensure that all patients with epilepsy do meet an appropriate doctor or medical facility where the epilepsy can be defined and proper diagnosis can be made and proper treatment can be started. Currently, we have several types of medical tests and examinations that give us very good information about the type of epilepsy and the treatment that it requires. And facilities are springing up across the country, and we should encourage people with epilepsy to seek such medical attention. A CT scan, an MRI brain, or an EEG would be done in most epilepsy patients to try and diagnose the type of epilepsy. Medications are available, they are reasonably cheap. It's available even in government hospitals, in private hospitals, and these medications are very effective. We need to encourage our patients to follow their doctor's advice, take medications regularly, and these medicines are long term and need to be taken for several years, at least 2 years or more, to get the desired result from the treatment. So it's very important to not only go for the initial consultation and get the good diagnosis, but also to persist with the treatment, to continue treatment till we get the desired result. Treatment is effective and has to be given for all patients with epilepsy. Also, many people neglect lifestyle issues that affect the outcome. Some people take medicines regularly but do not sleep on time, do not eat on time, they have too much mental stress or physical stress, or they have habits such as alcohol or smoking that affect the seizure control, and this also has to be addressed if we have to get a good outcome. There are many myths regarding epilepsy, and many patients get mismanaged during an epileptic attack. We have all seen people talking about keeping an iron object or keys in the hands of a patient with epilepsy, and it has been scientifically proved that such practices are nothing more than just myths or superstition. A patient with epilepsy during an attack needs special care. You should make the patient lie down in a horizontal position, turn them over to one side, and support them till the seizure subsides. An epileptic attack usually lasts for 1 or 2 minutes, after which the patient remains drowsy for several minutes and then gradually regains normal consciousness. So at this time, it would be improper to try and feed the patient, give him water or milk when the patient is still drowsy. Many people also make attempts to try and open the mouth of the patient to prevent tongue bites from happening. And as you know, tongue bite does happen in many kinds of epileptic attacks. But trying to insert finger, spoon, cloth between the teeth can lead to further injury to the patient and could even be a danger to life. The other thing that we should also know is, if you have a seizure that is not controlled, that is prolonged, that goes on for several minutes, then such a patient needs urgent medical attention and needs to be taken to the hospital immediately. Patients who are adequately investigated, who are properly treated, have an excellent outcome in terms of their quality of life. They are highly successful in their professions and do have a very productive professional life and a normal married life. Epilepsy treatment does not come in the way of fertility. It does not come in the way of becoming pregnant in case of women, in giving birth to healthy children, and children of such patients are normal in all aspects. Epilepsy is rarely genetic, and therefore, if one of the parents has epilepsy, it's very unlikely that the child would have epilepsy as well, and such fears need to be discussed with the doctors who will give you the right information. People with epilepsy can have a very productive professional life. There are no major restrictions in their physical or intellectual activities except certain conditions like driving or swimming, which are not advisable in these patients. And as you might be aware, there have been extremely famous intellectuals, kings, emperors, sportspersons who have had epilepsy and are still world famous for their achievements in their respective spheres. So I would like to encourage all patients who have epilepsy to seek the right medical attention, to follow their doctor's advice, and to be very regular with their medications so that their epilepsy can be controlled, and hopefully we should be able to even stop or reduce medications.